let me introduce Dr. Kusum Bhat. Dr. Bhat, PhD, is a certified biofeedback specialist with doctoral degree in clinical psychology, and she is currently the clinical director at Concord Weight Loss Clinic and a professor at Saybrook University in San Francisco for doctorate students. Dr. Bhat, welcome.
Thank you, Praveen. Thank you, everybody, for joining this session. And it's my pleasure to be here today. Today's topic is very much emotional, as well as we would like to give you some information where you can take this information, measure, monitor, and modify how you can solve some of the problems. So today's topic is supporting informal caregivers and families of patients with a serious illness. In other words, it's caregiver fatigue and compassion fatigue. Fatigue or burnout occurs due to overload. The overload depends on three factors: frequency, size of the load, and duration of the load. Just imagine you're carrying a heavy box and then your muscles are fatigued, and it's based on how many boxes you carry, how far you carry, and how heavy it is. Similarly, when you are taking care of somebody, your kith and kin, fatigue occurs in physical, mental, and emotional factors. For that, today's topic, we are going to give you how to measure using measurable scales. Just like when you go to a doctor, or when you have to measure your blood pressure or your weight, or when you have say diabetes, and then you check your blood sugar, there are many scales where you can measure what is happening to your stress and burnout. One of the most user-friendly that you can use, and I will give you some of the link, is Christina Mashlow's burnout measure scale. That in fact, we had the pleasure of working with Christina and developing a test on anxiety in UC Berkeley. And the other ones are AMA, caregiver burnout scale, and then APA burnout scale. Why we need that? Because it's not only taking care of the patients, and we need to take care of ourselves. Sharing your needs and your problems with your family and friends, and when you share, you would know you're not the only one. I'm sure we all had gone through some time or the other the issues, whether it is a short term or long term or longer time. You will come to know that of course, when you have the issues, you feel, and we also feel that it's very hard. At the same time, probably people will have their own personal things that they have dealt with. Unless you ask, you would not know. Especially in the Indian community, if you feel that to have that stigma, because I have it, and I don't know how to do it and how to share. On the other hand, once you start talking about it, you will come to know you are not the only one. For that reason, take advantage of your community support, take advantage of your needs, and then talking to people, talking to your family, and talking to your friends. Because when we came to this country, we left our kith and kin, most of them back home, and then our friends became our own family. And then so for that reason, talking to them is very important. And then especially few people that you are close to, and then you will know how to deal with your own issues by sharing. I just wanted to add one more thing. I know when we have, conditions, and then we all feel that is it ever going to end? There are times, and then you have a happy ending, and then look forward to having that happy ending and have a positive thinking that it will happen. That has happened in our personal life, and we had a child who had Guillain-Barré syndrome, where she was completely paralyzed, and we thought that is the end of her life. And now she's a grown-up woman and became a successful physician, as married and have children. At that time, it was very difficult. Things change, and then you will have happy ending many times also.